All right, everybody, welcome to another deep dive. Today, we are going to be going over skin disease coding.
Oh, yeah.
We're going to be talking about pressure ulcers, those non-pressure chronic ulcers,
Mm-hmm.
how medical professionals are using the ICD-10-CM system to classify them.
Right.
It's like a whole secret language that can unlock a deeper understanding of medical records.
You know what's really fascinating about this system is it's not just these abstract codes, it has a real-world impact on patient care and how we track the progress of these conditions.
Absolutely.
Yeah.
And to kind of help us through this complex coding landscape, we have a handy link down in the description to the Absolute Medical Coding Institute's Medical Coding Guidelines MCG manual.
Yes, definitely a must-have.
Think of it as your trusty guide.
So when we talk about these pressure ulcers, they develop when you have constant pressure on the skin that restricts blood flow and it causes tissue damage.
Okay.
It's kind of like when your foot falls asleep if you sit too long, but on a much more serious scale.
Okay, so we understand how they form. But how do medical coders determine how severe a pressure ulcer is? What are the signs that they look for?
That's where the ICD-10-CM classification system comes in.
Right.
And it uses stages to describe the severity from stage 1 to stage 4.
Okay.
But it gets even more nuanced than that because we also have to consider deep tissue pressure injury, unstageable ulcers, and unspecified stages.
Hold on. Unstageable versus unspecified stage?
Right.
Those sound pretty similar. What's the difference?
That is a good question. It's all about visibility. Unstageable means we can't see the full extent of the damage because it's covered by dead tissue called eschar.
Mm-hmm.
Imagine a wound concealed beneath the layer of debris. Unspecified stage, on the other hand, is used when the documentation lacks the details needed to assign a specific stage.
So it's more about what information is available in the patient's records than the actual appearance of the ulcer itself.
Precisely. And this highlights a crucial point. Accurate documentation is paramount in this whole coding process. The more detailed the documentation, the more accurately we can classify the ulcer.
That makes a lot of sense.
Yeah.
But what about when an ulcer starts to heal?
Mm-hmm.
Does the code change, even if the initial stage was pretty severe?
Absolutely. Here's how it works. If an ulcer is completely healed, when a patient is admitted, we don't assign a code.
Okay.
Makes sense, right? But if it's healing during the patient's stay, we use the appropriate stage code based on the documentation.
So we're capturing the healing process in the coding, not just the worst point that the ulcer reached.
Exactly. And here's where things can get even more complex. If an ulcer progresses to a higher stage during a patient's stay, we have to assign two codes.
Oh, two codes.
One for the initial stage upon admission and another one for the highest stage it reaches.
That sounds like it can get tricky, especially if the ulcer goes back and forth between stages.
It definitely requires careful attention to detail and a thorough understanding of the guidelines. And speaking of guidelines, there's a really helpful tool called the TAP method that's mentioned in the MCG manual.
TAP method. Okay, I'm intrigued. Tell me more.
TAP stands for Tab, Annotate, and Place. It's a fantastic way to navigate the ICD-10-CM guidelines quickly and efficiently.
Okay.
You basically tab the relevant page, annotate the guideline for easy reference, and then place the word TAP next to the relevant code in the tabular list. It's like having a personal roadmap through the coding jungle.
That sounds incredibly helpful. It's like having little breadcrumbs guiding you to the right information.
Yeah.
Now, before we move on to those non-pressure ulcers, I want to touch on something you mentioned earlier, the importance of accurate documentation. It seems so important.
Accurate documentation isn't just about following rules, it's about ensuring patients receive the appropriate treatment and resources. It impacts everything from insurance claims to clinical research.
It's like a ripple effect.
Hmm.
A seemingly small detail in a medical record can have huge consequences down the line.
Exactly. And this is particularly true when we delve into the world of non-pressure chronic ulcers, which is where we're headed next.
All right, so let's shift gears and explore those non-pressure chronic ulcers. What sets them apart from the pressure ulcers we've been discussing?
The key difference, as the name suggests, is the cause.
Okay.
Pressure ulcers, as we've discussed, stem from sustained pressure on the skin.
Hmm.
Non-pressure ulcers, on the other hand, arise from other underlying conditions like diabetes or poor circulation.
So we're talking about ulcers like diabetic foot ulcers or venous stasis ulcers.
Exactly.
Conditions that can be just as serious as pressure ulcers, but require different treatment approaches.
Precisely. And while both types of ulcers are coded using the ICD-10-CM system, the focus shifts slightly with non-pressure chronic ulcers. Instead of those distinct stages we saw with pressure ulcers, we often look at the severity or extent of the ulcer. Is it superficial? Deep? Is there any sign of infection?
So it's less about visual depth and more about the impact on the surrounding tissue.
Exactly. And just like with pressure ulcers, we need to consider factors like healing status and any changes in severity during a patient's stay. The goal is to paint a complete and accurate picture of the ulcer's progression.
It's like a detective story, piecing together clues from the medical record to arrive at the most precise code. And speaking of precision, let's talk about those MCG manual TAP annotations. I'm still amazed by how they can streamline the coding process. It's like having a secret weapon for navigating this complex system.
It's a game changer, really. The MCG manual does a fantastic job of distilling the ICD-10-CM guidelines into a user-friendly format, and those TAP annotations are like little signposts guiding you to the most relevant information. They help you focus on the key details and avoid getting lost in the weeds.
I'm already imagining all of the medical coders out there breathing a sigh of relief knowing that this tool exists. It's like having a coding guru whispering in your ear, hey, pay attention to this.
Exactly. It's about making the coding process as clear and efficient as possible. After all, we want to spend less time deciphering guidelines and more time focusing on what truly matters: patient care.
Well said.
Okay.
And on that note, let's take a moment before we dive deeper into the specific coding guidelines for non-pressure chronic ulcers.
Okay.
We'll come back and we'll jump right back into it.
Sounds good. So let's imagine a patient is admitted with a non-pressure chronic ulcer that's documented as healing.
Okay.
Does that automatically mean it gets a less severe code?
That's a great question. I would assume healing implies improvement, so maybe a less severe code would be appropriate.
Not necessarily. While healing tells us the ulcer is improving, it doesn't actually specify the current severity level. We need more information from the provider to assign the most accurate code.
So even when an ulcer is on the mend, we still need to be really precise with the coding. It's not just a one-size-fits-all situation.
Exactly. And that brings us to another common scenario. What happens when a non-pressure chronic ulcer actually worsens during a patient's stay? Just like with pressure ulcers that progress to a higher stage, we need to assign two codes. One for the initial severity level at admission, and one for the highest severity level it reaches during the stay.
Okay, I'm starting to see a pattern here. It's all about capturing the full spectrum of the ulcer's journey, from its initial presentation to any changes that occur over time. We're not just taking a snapshot, we're creating a whole timeline of its progress.
You got it. Accurate coding paints a dynamic picture of the patient's condition, which is essential for providing the best possible care.
Speaking of the best practices, I'm curious about those times when the documentation might be unclear or incomplete. What happens then? Do coders just have to make their best guess based on the available information?
Definitely not. Guesswork is never a good idea when it comes to medical coding.
Right.
If there's any ambiguity in the documentation, medical coders are trained to query the provider. It's all about ensuring that the coding is accurate and reflects the patient's true condition.
So it's a collaborative effort between the coder and the provider.
Absolutely. Think of it as a system of checks and balances to ensure the highest level of accuracy. The coder brings their expertise in interpreting guidelines and assigning codes, while the provider provides the clinical context and detailed observations.
That makes a lot of sense. It's about bringing together different perspectives to create the most accurate and comprehensive medical record possible.
Exactly. And this collaborative approach is essential, not just for coding accuracy, but also for patient safety. By working together, coders and providers can help ensure that patients receive the appropriate treatments and interventions based on their specific needs.
It's all connected. Accurate coding leads to accurate billing, which impacts insurance coverage, which ultimately affects the patient's access to care.
Yeah.
It's like a chain reaction.
You're hitting on a really important point. The impact of coding extends far beyond the medical record itself. It has real-world consequences for patients' healthcare providers and the entire healthcare system.
And this brings us back to those MCG TAP annotations, which can be a real lifesaver for coders navigating this complex world. I'm still impressed by how this simple method can make such a big difference.
The TAP method is all about simplifying a complex process. It helps coders quickly locate the information they need, reduces the risk of errors, and ultimately enhances efficiency.
It's like having a cheat sheet for medical coding, but in the best way possible. A cheat sheet that ensures accuracy and promotes patient well-being.
Exactly. And speaking of patient well-being, let's shift our focus back to pressure ulcers for a moment. There's one unique type of pressure ulcer. I want to discuss pressure-induced deep tissue damage.
Pressure-induced deep tissue damage. Okay, that sounds pretty serious. What makes it different from other pressure ulcers?
This type of injury occurs when there's damage to the underlying tissues, even if the surface skin appears intact. Think of it like a severe bruise, but much deeper and potentially more dangerous.
So even if there's no open wound, there could still be significant damage happening beneath the surface.
Precisely. And it's crucial to recognize and document this condition accurately because it can have serious consequences if left untreated.
That's pretty alarming. So how do we identify and code this type of injury? Are there specific signs or symptoms we should be looking for?
While the surface skin might appear intact, there are often telltale signs like a deep purple or maroon discoloration of the skin. Sometimes there might be a blood-filled blister or a thin layer of damaged skin that feels different to the touch.
So it's not just about looking for an open wound, it's about paying attention to subtle changes in the skin's appearance and texture.
Exactly. And this is where the expertise of healthcare professionals comes in. They're trained to recognize those subtle signs and differentiate pressure-induced deep tissue damage from other types of skin injuries.
It sounds like a real detective job requiring careful observation and a thorough understanding of the underlying anatomy.
It is. And once pressure-induced deep tissue damage is identified, it's assigned its own specific code L89-6. This code ensures that this specific type of injury is tracked and treated appropriately.
So we're back to the importance of precise coding. It's not just about following rules, it's about ensuring that patients receive the most targeted and effective care possible.
Absolutely. And that's why those MCG TAP annotations are such a valuable tool. They help coders navigate the complexities of the ICD-10-CM system and ensure that even subtle but important conditions like pressure-induced deep tissue damage are coded accurately.
It's all about connecting the dots between medical terminology coding guidelines and ultimately patient well-being.
Couldn't have said it better myself.
Now, before we wrap up this deep dive, let's take a moment to recap some of the key takeaways from our discussion today. We've covered a lot of ground from pressure ulcers to non-pressure chronic ulcers, and even delved into the complexities of pressure-induced deep tissue damage. It's amazing how much information is packed into those ICD-10-CM codes and how they can impact patient care in so many ways.
What's remarkable is how this coding system, despite its complexity, ultimately serves a very human purpose. It helps ensure that patients receive the right care at the right time based on their individual needs.
It's like translating a complex medical language into actionable insights that can guide treatment decisions and resource allocation. And speaking of actionable insights, I have to say those TAP annotations in the MCG manual are a real game changer. They make navigating those complex coding guidelines so much easier.
Right. They really streamline that coding process. It's like having a shortcut to the most crucial information, which frees up medical professionals to focus on what really matters their patients.
Absolutely. So to bring this all back to our listeners, why should they care about skin disease coding? What's the takeaway for them?
Whether you're a healthcare professional, a patient, or simply someone who's curious about the inner workings of the medical world, understanding the system can be incredibly empowering. It allows you to decipher your own medical records, advocate for your health, and have more informed conversations with your healthcare providers.
It's like having a key to unlock a deeper understanding of your own health journey. And for those who want to go even further, we encourage you to check out that MCG manual linked in the description. It's a treasure trove of information that can really enhance your understanding of this field.
Definitely worth exploring. The more we understand about how medical information is coded and used, the better equipped we are to navigate the healthcare system and advocate for ourselves and our loved ones.
Well said. And on that note, we'll leave you with one final thought to ponder. Imagine a future where medical coding is so seamless and intuitive that it just fades into the background, allowing healthcare providers to focus entirely on their patients. What innovations might make this vision a reality? How could technology and artificial intelligence transform this field?
That's a fascinating question to consider. Until next time, keep exploring, keep learning, and keep diving deep into the world of knowledge.